Actually, it's not that sunny right now.
Yeah.
It
No,
rained yesterday.
I
Yeah.
think it's perfect. Yeah, we've got our rain coming back here in Portland. We had a really beautiful last week. It was up in the 80s, and now we're kind of
Yeah.
back to our typical spring. So,
Yeah. Yeah. I know. I totally get it. We lived in Seattle for a number of
oh,
years, so
oh, you did.
very
Um,
similar weather.
yeah. When were you in Seattle?
From 2009 until, oh God, that's not going to work. Sorry, that's my dog. Let me move him.
Okay, sure.
Hey guys. No. Can you bring him upstairs, Ryan? Thank you. Sorry.
That's okay.
From 2009 until 2015.
Oh, okay. So you've only been down in California for the past 5 years or so.
Yeah. Well, I mean, we started here. The
Uh-huh.
Seattle was a California hiatus, but
Yeah.
I'm from Southern Cal originally, so
Yeah, me too.
yeah. Whereabouts?
I grew up in Hacienda Heights.
Okay. One of my good
Yeah.
friends grew up in Hacienda Heights.
Oh, really?
Yeah,
Where
yeah.
did you grow up?
And like the South Bay and Hawthorne,
Uh-huh.
kind of near
Mm-hmm.
Lawndale, Torrance.
Yeah, I'm
Down there.
familiar. I
Yeah.
saw in your bio that you did some of your training at UCLA, and that was my undergrad.
Yep. Yeah.
Yeah,
Yeah.
cool. Well, thank you for doing this.
Sure.
So I started kind of brainstorming the podcast when I don't remember if I sent this to you in the email, but I saw a female pilot when I was flying somewhere, and I was like, gosh, I bet she went through a lot of the same things that I did in a more male-dominated field,
Mhm.
and I just thought it would be really interesting to talk to women in many different fields. And so I have a sprinkling, a handful of women who are in medicine, but a lot of other women in just completely, varied fields, ranging from business to engineering to I have somebody who's in the paper industry, which I never would have thought of, but a lot of men. And just trying to have it be conversational as much as possible. I have some questions that I've thought of and kind of start. I'll start with sort of the origin story, your history, and wrap up with some advice for women and where people can find you online if they want to keep up with what you're doing. But the middle part, there are really so many different things that we can talk about that pertain to the female experience in a male dominated field and influences. So we'll just kind of roll with it, and if we go off on a tangent, we go off on a tangent. We'll just kind of let that flow, and then at the end I'll just ask you, what's your one piece of advice for women who want to go into either your field or a male dominated field, and then where people can find you. um,
Sure.
I wanted to quickly, let me just look at my
And
note
you just
here.
randomly found me on Twitter? Was that the
Somebody
I don't
recommended
remember
you.
where the connection came
I
from.
don't even, I was just thinking about that, and I don't remember who recommended you, but they said you should talk to Leah and she
That's
would be great.
funny.
And I was like, she sounds awesome. So thank
That's
you for doing
funny.
this. Yeah,
Yeah.
I've actually gotten a couple of interviews just completely randomly on Twitter, either through recommendation or I've just reached out or someone said, hey, you should go find this person. And so yeah. Um,
That's
I
great.
I want to make sure I am pronouncing your last name correctly.
Hmm.
So is it Bacchus or Bacchus?
It's just Bacchus.
Bacchus.
You said it
Okay.
right the first time. Yeah.
Okay. Okay. And is there I'll read kind of a condensed version of the bio that you sent me as an intro that'll play before our interview starts, and I have everything that you sent to me. Is there anything in particular that you want to highlight or anything that isn't on your professional bio that you would like to include?
No, not really.
Okay.
I don't remember what I sent you, but I mean, nothing strikes me that needs to be highlighted in general. So
Okay, that sounds good. And then it sounds like you're also a mom.
Mm-hmm. Yeah.
Yeah. How many kids do you have?
Two teenagers.
Okay. Two teens. Okay.
Yeah. Yeah.
Um,
One boy, one girl.
oh, nice. Okay. All right. Um, and I think we could probably get started and we'll just chit chat about everything else. Does that sound good?
Sounds
Okay.
good.
I double check that I'm recording, got my mic on. I'm kind of new at the podcast thing. I still haven't launched. I hope to launch in June. So,
Okay.
all right. So I'll pause for a second and then I'll just say hello and welcome.
Okay.
Hello, Leah. I am so excited to have you on the podcast today.
Hi, Nancy. Thanks for inviting me.
So I am always I obviously have a soft spot. We talk to women on this podcast of many different fields and careers and backgrounds, but I always have a little soft spot for my fellow surgeons. So I'm really excited to talk to another female surgeon. It's really exciting. So I gave a little bit of an intro as far as where you are practicing now. You're a cardiothoracic surgeon, or otherwise known as a CT surgeon. We have listeners who are obviously not in medicine, and can you please tell us a little bit about what it is you do day to day, the kind of surgeries you do, the kind of research that you do?
Sure. So cardiothoracic surgery is surgery that involves pretty much anything in, on, or around the chest. Um, there are three major divisions: cardiac, which would be more heart focused; thoracic, general thoracic, which is sort of all the non-heart items, if you will, in the chest; and then congenital for the babies who have
Mhm.
various defects that are addressed. And so I practice general thoracic surgery. Um, and I'm in that division at Stanford. Um, and you'll find, of course, you know this, but also for the listeners, that if you're in private practice, oftentimes you practice more than one. So you'll do both cardiac and thoracic. But in academic surgery, you tend to stick to one or the other. So for me, that's thoracic surgery, and on a day-to-day level, that winds up being a lot of lung cancer. That's sort of
Mhm.
the lion's share of what I do. But then there's also a smattering of all sorts of things, from chest wall defects, other cancers in and around the chest, but there's just a lot of cancer in general. Esophageal cancer, probably the second most common one. Tumors that have spread to the chest. But also some benign disease as well that have to do with your esophagus and the upper portion of your GI tract and whatnot. So, and then being at an academic center, a big part of my job is teaching. So
Mhm.
obviously we teach all the way from undergraduates, even, believe it or not, to med students, and then to our residents and fellows at the tail end of their training. And then another component, sort of the triad, if you will, for academia being research. I have a couple of grants that are not totally related, but my primary research is health services research and looking at surgical outcomes, a little bit of disparities research, but mostly focus on imaging surveillance after treatment for lung cancer. How best do we survey patients to make sure that we are able to identify quickly and effectively if and when they should have recurrences or develop new cancers.
And I want to mention that the podcast is called The 6%, and that's named after the percentage of women practicing in orthopedics. What do you think is the percentage of women in CT surgery?
Yeah, I'd say as of at least maybe 10 years ago, it was around 6% as well. I think that we kind of run neck and neck with orthopedic surgery.
Hmm.
The only surgical discipline worse would be neurosurgery. So we're all sort of at the bottom of the pack.
We got a lot of work to do.
There's room for growth for sure. Um,
Absolutely.
I mean, there has been a trend towards improvement over time. I want to say probably the most contemporary numbers would be on the order of 8 or 9%. It's still less than 10%. So, I mean, while we take our small victories where we can get them and say, thank you, I'm glad to have a few more numbers, but it would be great to see it more representative of our patient population.
Right, absolutely. And kind of on that same note, when you look at the number of women in some of these surgical fields, they're very low, but then you break it down further and you look at people of color who are also women, that number gets even smaller. Right.
It does, absolutely. You
Yeah,
kind of have a double whammy effect, if you will, but
absolutely.
or you could consider yourself a twofer, which I like to do.
A twofer, yeah.
but
That's
but yeah,
awesome.
the numbers. I mean, it's hard to parse out really, really small numbers. But yeah, I know. I think I know all of the African American female thoracic surgeons. And the first one is still practicing. So that just tells you how um, recent the
Mhm,
progress has been. Um,
absolutely.
but yeah,
Yeah. So I want to share a little bit with the listeners. We're both surgeons, but I will say that even among surgeons, I think there's kind of like a badassery hierarchy, and and I'll say that as an orthopedic surgeon that operates near the chest, like on a clavicle, what I want to do is stay out of the chest, right? Because that's when you guys come in and
right.
you save us. Not that that's happened to me, thank goodness, knock on wood, but yeah, definitely, even among surgeons, there is a great deal of respect from us for our CT surgeon colleagues. I want to go back a little bit and have you tell us a little bit about your childhood and your upbringing, what that was like, and kind of all the different things that you encountered and experienced growing up that led you to where you are now?
Um, so I don't think that I have a really unique story, if you will. And perhaps that will be reassuring for some of your listeners. I don't think you have to have some special brand or mark upon you bestowed by a deity that makes you, more versus less, apt to travel this path. I think if anything, I was sort of um, clueless but lucky. But I grew up in Southern California, um, raised with my mother, who was a single working mom, and my brother. Um, you know, always sort of labeled as a smart girl uh, very early on, which I think is good, but also sort of sad if you think about what happens if you don't get that label.
Mhm.
At that time, there was all this emphasis on tracking of students that were deemed to be brighter, who were going to have more potential to go further, et cetera. So, I was always in the accelerated class, the special classes, that sort of thing. But it wasn't because I sought after it at all.
Mhm.
It was thankfully, I think, because I had teachers that saw something special enough that warranted that extra attention. But it always struck me as odd, because then I had to kind of have two sets of friends, if you will. Like I had all my nerd friends in my nerdy classes, which are great, and then I had sort of my more casual friends who I had a whole lot more in common with. And who I saw much more routinely outside of school and that sort of thing. But I never thought that my non-nerd friends weren't smart. We just happen to not be in the same classes, and I think that again,
Mhm.
that was that whole tracking system. um, I when I was in the sixth grade, I said I wanted to be a neurosurgeon. and and that I wanted to go to Stanford, and I don't really know honestly where those two concepts came into my head from, but I honestly think that they were positively reinforced by the feedback that I get from people around me, the adults around me, when I told them what I wanted to do. It was like, oh, wow, you really must be smart, or you really are going to do big things and that sort of thing. So I think I kind of held on to those goals very fiercely because I did get so much positive feedback. Um, I can recall sitting down with my high school counselor when applying to college, and very naively saying that, she said, where do you want to apply? And I said, I want to go to Stanford, so I want to apply there. And and she's like, okay, and where else? And I'm like, what do you mean? Like, I mean, why would you why would you apply to somewhere else if that's where you're planning to go? Like, that's how clueless I was. Um, so
Did
she said,
you,
well,
or did you just apply for the one?
no, I applied. I don't know, maybe
Okay.
like 10 schools or something. But it was funny because then her next question was, well, you got to have like a backup school, like,
Mm.
a backup school. I said, okay, well, then it will be Cal, which which is kind of hilarious, right? If you consider how ridiculously difficult it is to get into Cal. But I mean, that was my backup. But anyway, the
Right.
point being that I was pretty uninformed. But and then I went to Stanford, and then on to med school, and I held on to the whole thought of being a neurosurgeon all the way up until the second year of medical school,
Oh, wow.
when I met with the person who was then chair, and had a very, very lackluster meeting. It just was not encouraging in the least bit. It was sort of very, I don't know, off-putting.
Well, what
And
do
it
you
just
think
goes to,
were I'm sorry, go ahead.
I was just going to say, it just goes to show you how even small interactions, like this person probably couldn't recall this to save his life, right?
Mhm.
But for me, it was a pivotal meeting and a pivotal moment when I was like, okay, well, then that's probably not going to be for me. Something I'd held on to for like,
Mm,
12 years up to that point, it, was
right.
sort of gone not in an instant, but pretty quickly.
Right. And I
So,
hear about stories like that all the time, and when I'm on social media, I often interact with young women who are in various stages, whether it's high school or in college, and they want to go into medicine or go into orthopedic surgery. That I often will get messages about that saying, wow, it's really refreshing to see a woman who's also a mom who's in this field, because my counselor or my whoever, or I worked with an attending who said, this is not for you. And then people just say, oh, well, I guess it's not for me. And they kind of look for plan B. But I always find it aggravating how sometimes people who are in those positions don't really think about the impact of their words. What specifically
absolutely.
turned you off? Was it something directed about your ability, or did it have anything to do with you being a woman, or what about it kind of said, oh, I
Um,
don't think this is for me anymore?
it didn't have, well, I don't know if it had to do with me, my ethnicity or gender, because that wasn't explicitly stated, if you will. But it was definitely just the overall vibe, for lack of a better word, that
Mhm.
was relatively unwelcoming. But then he specifically said, oh, well, where did you go for undergrad? And I said, Stanford. And he said, oh, well, we only take Ivy League graduates
Ugh.
into our program.
There's I bet there was probably we could pick apart so many things wrong with that conversation.
Right? I know. So I think that was probably if I had to whittle it down to a single statement, it was probably that statement.
Yeah, yeah.
Um, the sort of elitism that was exclusionary, even to the point of someone who's otherwise eager, who has a pretty decent pedigree at that point, that you would otherwise shun them because it didn't fit some sort of stereotype that you had in your head as to who they should be
Right.
to join your club.
It
Um,
kinda just decreases your talent pool right then and there. It's too bad.
absolutely.
Yeah.
Absolutely.
Who do you think were your biggest influences and or mentors, going into CT surgery after you decided to pivot?
Um, I mean, I had a lot, and I can say that the majority were all men, um, because that's who's there,
It's
right?
true. Yeah,
You
that's who's
know,
there. Yeah.
you need male mentors,
Yeah.
for sure. And I've had some really good ones at every stage, honestly. And I think that that's tricky because you want your mentor mentee relationship to be somewhat organic, right? Like that it's
Mhm.
a good fit, that it makes sense, that you've had some trial and error and that sort of thing. That it wasn't just that oh, I'm assigned to you. We must meet. We must talk. Now we check a box. We've been
Right.
counseled, etc. Right? Like you want
Right.
them to have some investment in you and your future.
Mhm.
Hopefully to sponsor you for the next level and so on, and move beyond pure mentorship and move into sponsorship and that sort of thing, where they really have some um, equity on the line and really invested in your success. So I've had a ton. I don't know. I can't really call them out. I hate to call them out because then I feel like I would lose something in the ones that I don't call out.
Right.
Um,
This is like reading your thank yous when you're accepting your Oscar, right?
right. Yes,
You don't wanna forget somebody.
exactly. I don't have my Oscar thank you list. I also don't have an Oscar forthcoming, but um, gosh, I don't know. There've been so many, and I think the biggest take home is they haven't been female, and some, but not most, have not been African American either, right? Like,
Mhm.
and that's
Mhm.
great. That's how it should be. It should be an equal opportunity for people to connect, um, openly with the
Right.
people that they gravitate towards, etc. So
Right. Yeah, and I often think about how it is important to have faces that look like you in the field that you're hoping to go into, but at the same time, I absolutely don't discount the importance of having people that don't look like you that will have your back and that will support you and that will speak up for you or on your behalf when something's not right, you know? Um, and so that's like the he for she movement
I
that we hear
remember,
about.
yeah, yeah. I was going to say, I remember as like a junior resident in general surgery, uh, one nameless attending uh, asked me if I had any Black female surgeon mentors. There were none in the department. I think I was only the ninth resident, African American resident ever in our whole
Mhm,
program history.
mhm.
Uh, so I wasn't the first, but and I was like, no. I mean, do you
Did
know any? I mean,
did you
no.
did you find that to be a little bit of a weird was it a
It
weird
wasn't.
question?
I did. I found it super weird. It was also off-putting, well, partly because this particular attending was not like we weren't cool like that. I didn't feel.
Yeah.
And I think, however, to his credit, if I have to give some credit, that he really, I think, did have an altruistic motive, that he was
Mhm.
doing what he thought was going to be very helpful, but it wasn't helpful because it was simply pointing out a deficit with no plan or assistance in addressing it. So it was sort of
Mhm.
like, do you feel bad that you don't have any mentors that look like you? Yeah, you should. That sucks. You know what I mean? It was like, it
It's
just sort of
like,
fell flat, you
what's
know?
what's the point?
Yeah,
That
I didn't
actually
know what the point. Well, he's like, well, you should get one, and I'm like, yeah, I don't know where you find them.
Yeah,
So yeah,
and thanks for that.
yeah, exactly. Duly noted.
Right. What would I have a good question for you. What at this point keeps you up at night? Like what kind of things kind of gnaw at you and just kind of keeps coming back at you and it's kind of a broad question, but
That is a broad question.
yeah.
Um, Probably my kids, honestly, first and
Okay.
foremost, because they're teenagers,
Yeah.
and
Yeah.
so their lives are changing by the minute, and
Right.
trying to keep up with all of that and be close enough, but not hovering, keeping your finger on the pulse of what's going on with them, but allowing them some space to grow and make mistakes, um, eh, and all of that. Like, I feel like I was pretty self-sufficient. Not
Mhm.
that I didn't make mistakes, because I certainly did, but like, constantly comparing them to me is a losing proposition, or comparing them to anyone in my generation is a losing proposition.
Yeah.
Um, so I think that's honestly what that's probably my toughest job right now, is trying not to screw that up,
Yeah.
and trying to balance that with the demands of work, obviously. And my husband is fantastic, so it's not like I'm doing this all by myself or anything, but
Mhm.
he's busy. He works too. Um, with a high level job. So it can be tricky, sort of keeping all the balls in the air.
Right.
That's
Right.
that's the thing, and not wanting to uh, compromise any one of the various hats that I wear.
Right.
Uh, so yeah, it's a moving target, keeping things somewhat pared down into a manageable amount of things that I'm doing and not being overextended. And I
Mhm.
fall short of that mark often. So I'm still trying to work on that. Ironically, this whole COVID and quarantine thing has sort of injected a little bit of a pause to
Mhm.
give you a little bit of mental space, I think, to take inventory and say, huh, well, like I've literally missed about 5 trips in this past, 6, 7 weeks of quarantine. That's a
Right.
lot of trips, actually. And in retrospect, that probably would have been too many, you
Mhm.
know?
Mhm.
So perhaps I need to be more discerning in terms of the time that I spend away, knowing my children aren't going to be in my house for that many more years, et cetera, et
That's
cetera. So
true.
those are the types of things that I worry about so much. I don't really worry about the technical aspects of surgery. That would be early on, like the
Mhm.
night before every case, just thinking about the
Mhm.
case through your head and running through scenarios and that sort of thing. So I feel like fortunately I've sort of arrived at a place where I don't do that all the time. I certainly do it periodically when I have tough cases, but
Mhm.
technical is not the biggest challenge. It's the balance and making sure that I'm remain attentive enough at home.
Right. And one of the themes that I've seen among the women that I've talked to on this podcast is that we seem to all wear a lot of hats, and not everyone's a mom, but there are a lot of women who have these amazing careers and are very dedicated to their careers that are also parents. And I think a lot of times, especially, lately with the COVID pandemic, as a lot of children are at home doing online learning, there seems to be a lot of times a common theme where women who have these careers are now also thrust into home educator status and trying to juggle even more than they normally do. And there is sometimes an inequity there. And I don't mean to throw anyone's husband or partner under the bus, because I'm also very lucky. I have a very supportive husband, and he definitely pitches in, but I feel like sometimes women feel the weight of that more. And even when it's not like the partner is saying okay, or the spouse is saying, okay, this is all on you. This is your job. It's just that we tend to want to take that on. It's almost like it's our natural tendency. I mean, what do you think about that?
I mean, I think that your point is well taken, which is that I do think that, obviously we're speaking in generalities here, but that,
Yeah, very general.
women
Yeah.
do feel the weight of uh, just stuff that needs doing more, like simple, a, a simple task, a household chore or something that you're like, okay, I've got to do that. It's on my list today. I got to call the this, da, 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 da. For my husband, for his list, it may be way down, very low priority. And if it doesn't happen, it's not really the end of the world. And so, but there has to be some sort of happy medium. I do think that we could kind of borrow a page from the supportive spouse handbook, and because sometimes he does that. He'll check me and say, "Listen, like you've been stressing out about X, and should you really be stressing out about X? I mean, like,
Yeah.
what would happen if you just didn't go or we didn't do it or whatever?" And then it's like a nice little reality check where you're like, huh,
Mhm.
okay,
You're right.
yeah, maybe that just has to go.
Yeah. Yeah.
So it's not an all or none thing for sure, but yeah, I do think on balance that uh, we kind of shoulder more because we place more importance on things that otherwise uh, others may not.
Yeah. And
But I also think that that speaks to the whole surgeon mentality too. Like we're
true.
fixers, and
Yep.
like literally that would be my nickname with the kids, like mommy fixes things. Like, right? You fix things literally, like it's
Yeah.
broken and you fix it,
True.
So I kind of feel like it bothers me to have a problem where I can think of a solution that's not being done. Like,
Yeah.
I'm like, how can you not? I mean, all you got to do is X, Y, and Z, like, so I think that there's some hard wiring there too, in terms of why we've chosen the fields that we've chosen,
Right.
in fixing things. I say to myself, I think I'd make a really crappy primary care doctor because I don't really like chronic disease.
Mhm.
And you need people who do, and people who do that well. um
Absolutely.
I would not want myself to be my primary care doctor. You know what I mean? Like, so
Right.
you gotta go with your strengths.
Absolutely. And I and you probably well, you came into medical school thinking you already wanted to be in a surgical field, but I think some of us come in and we're like, oh, we're not entirely sure. And I actually, oddly enough, came in thinking, oh, maybe I'll do primary care. And then it is really apparent very quickly, like it's almost this divide where people who go non-surgical go here, people who are surgical go here, and they're very clear surgical versus non-surgical personalities. And that was
Hmm.
clear earlier on, and I was like, "Oh my gosh, what was I thinking? That's not my strength. I'm
Right.
clearly meant to work with my hands." And so,
Right.
you definitely have the different personalities and what they gravitate to. And yes, I agree. Like we need excellent primary care doctors, and I'm not one of them. I wouldn't be a good one either.
But you also must have heard. I mean, I hear it innumerably. uh Oh, you're a surgeon, or you're a CT surgeon? I wouldn't have guessed that. You
Yeah.
don't seem like a CT surgeon. And I'm like, well, what does that seem like? It's always tongue in cheek. I know what they mean, right? But I want to make them say it. Like, what do you
Right.
mean?
What do you mean?
Why don't I?
Yep,
And I know it's meant to be complimentary and that sort of thing, but we got to think outside the box. Should
absolutely.
you
And
should you
yeah,
should like your providers. You should,
yeah,
have a connection with them.
absolutely. Yeah, you're right. I do get that all the time. You're a what?
Hmm.
So, well, I and on that note, I'd like to, and this is yet another maybe broad question, but it's always interesting to kind of hear how different people think about this. How do you define success? Like if you were to say, yes, you look back, I have led a successful life. What's your definition of that?
Hmm. I don't know that I have a working definition. I don't shoot for success. I mean, I'm trying to just be happy. I'm trying to, fulfill my primary goal as a parent to the
Yeah.
two people that I helped to create, um, and obligations to patients, and to try to, relieve suffering and extend life. Um, and then now, of course, more recently, also nurture myself and make sure that
Mhm.
I'm a well cared for, human being.
Yeah.
So that's really all I'm trying. Well, that seems like a lot. Like,
Well,
that's it. That's all I'm trying to do.
but I think maybe that's your then that is your definition of a successful life lived, right? If you were to be able to do those things.
Yeah, so I ask myself sometimes, like particularly right after you have, your first baby or whatever, like,
Mhm.
should I do the stay-at-home mom thing? I was already, in residency, so it didn't quite make sense for like, you kind of should have thought of that before. Um, but like, no, I mean, I would never give up motherhood for the purposes of being a surgeon, or the reverse. Like, I think that having the combination is important for me and my well-being, that I
Mhm.
derive immense, pleasure and, um, just satisfaction and self-worth, from doing both of those. So
Right. Right.
somewhere in
So
it is being a wife and daughter,
yes.
as well, the smaller slivers.
Yeah, absolutely. So you're the chief of CT surgery at the VA in Palo Alto, correct? Um, what do you think in that role is is different as far as being a leader as a woman? You know, what do you think, how do you think women lead differently than men, and what do you think are the effects of that?
I've taken a lot of leadership courses and
Mhm.
trainings and this sort of thing, and you
Yeah.
kind of glean little bits from each one of them. They're all somewhat different. But I mean, so I don't think I have anything earth shattering to add to that conversation, or that dialogue. But women are, I think, more collaborative in nature. Um, that we tend to lead by example, lead by committee, try to gain consensus prior to moving forward with things, a little bit more deliberate, sometimes to our detriment.
Mhm.
Um, I think there are a number of things that we could do better, like in terms of getting over like imposter syndrome and
Mhm.
looking for validation from others externally
Mhm.
that may not be forthcoming, and using that as a marker to both define your own like professional success and how is it that you interact with your colleagues and whatnot. Like that's a huge detriment.
Right.
That's not to say that people don't want to have validation and praise and things like that. Sure, we all want that. Everybody wants a pat on the back, right? But
Yeah.
it can't break you to not have a pat on the back
Yeah.
from those that aren't going to give it to you. You have to
Right.
figure out ways to internally reinforce yourself, build your resiliency,
Mhm.
and accentuate the positives and develop your own metrics. Like you said, how do you define success? Develop your own metrics
Mhm.
for where you should be. If you're not getting it from
Right.
elsewhere, you need to have
Right.
the fortitude to find it within or from your
Ab
peers. That was another thing I forgot to mention earlier. You asked me about mentors, and one of the things that I failed to mention was that I've derived a ton of benefit from peer-to-peer mentoring. And I think
Mhm.
that that's really critical when you consider the fact that the majority of your mentors who are ahead of you, and there's some hierarchical difference there, aren't going to look like you. Whereas you're
Mhm.
more likely to have peers who do look like you. And so not
Mhm.
only do they look like you, so they're having the same experience, but they're doing it in real time, you
Right.
know. And I have found my peers to be an invaluable resource when it comes to just having a sounding board. Hey, can I just tell you what happened today and get your thoughts on this? And they're like, yeah, that's crazy. Like that shouldn't happen.
It's
Because
just nice to have a barometer, right?
you might feel like you're a little bit crazy if you don't have a safe space or person with whom to talk about some of these things that are, you're not going to bring that up in a faculty meeting or
Mhm.
a division meeting, or like there are no formal forums for that. um, so you need to have a space, a place to put that, because if you don't deal with them,
Mhm.
then they're just going to fester, like a little nidus of infection.
Yeah, for sure. Absolutely. Can you think of a time when you felt imposter syndrome strongly, when you said to yourself, "Oh my gosh, what am I doing here?" Has that ever happened, and can you think of an example?
I think the first time that I felt that without knowing what it was when I started college. Because, when you're a senior in your high school, you're at the top of the heap, you're queen of the mountain, et cetera, et cetera. And then you get knocked
Mhm.
down pretty quickly once you start college, and you have this rude awakening where, like, oh, wait, everyone here is a rock star from their high school, right? Everyone here is
Yeah.
a high school rock star. Nobody really cares about what you did or didn't do or whatever.
Mhm.
Um, and it really is up to you. Like, you
Mhm.
have to learn yourself, learn what works for you in terms of your study skills, in terms of whatever it's going to take to be successful here. So I had one really crappy test. I don't remember if it was a quiz, a midterm, or something. It may have been a midterm. And I think I got like a C. And I ain't never got a C before, and I was like, wait, what? what do you mean?
Yeah. It's a shock.
But it was a good reality check. But I was also like, well, yeah, I just did everything that I normally do. And that wasn't good enough,
Mhm.
clearly. So either I could, it's sort of a pivotal point, because either you figure out how to make it better, or you just, wallow in self pity. I did that little wallowing in self pity for a bit there with the imposter syndrome. Like, well, maybe the
Yeah.
admissions committee made some huge error, in admitting me. Like, maybe I really shouldn't be here. And, I don't have the same background as all these guys. And that sort of thing. So when you already have a ton of insecurity around you because you're in a brand new place with brand new people and everything, to have
Mhm.
that on top of it really, really, really hurt. But I think in the end, that I had a positive response. But yeah, that was the first time. I was like, I don't think I'm supposed to be here. Clearly, they made a mistake.
Do you think as an attending, do you ever still get twinges of that, or do you feel like you have a better sense of recognizing it and kind of nipping it in the bud before it gets too far?
Um, it's still there periodically, much milder
Yeah.
forms. It can still rear its head. Um, like, I don't really like giving talks, but which is hilarious, right? Because you're in academia, you're always giving talks. And so,
Right.
I've figured out how to operationalize it and make it not to be such a huge thing. Um, but I often think of that before giving a talk. Um, so there's that, but I also try to remember that feeling. And if I feel like I'm hyper aware if I see it in one of my trainees,
Mhm.
so that I can try to bolster them and give them a little bit of, external support, until they develop their own internal support to get them through their
Right.
struggles.
Yeah. Now, and you mentioned your trainees, you play a pretty big role educating our next generation of surgeons. What do you think the surgeons going through training now have as their biggest challenges, and how do you think it's different than when you went through training?
Huh. Um, I think they have a lot. I mean, I think by and large it's very similar, honestly.
Mhm.
I don't think enough has changed to make it so like night and day.
Mhm.
From a technical standpoint, they have a lot more information that they're required to learn in that same finite time frame, which I think places them at a disadvantage, but also speaks to the fact that a lot of trainees then are adding on additional years of training after their primary board certification.
Mhm.
So there's that. I don't know. I think that in a lot of ways that their experience is better,
Mhm.
because I feel like things have loosened up a bit in terms of how is it that they can acquire their training. Like it used to
Mhm.
be, it was just one train that came to the station, you got on, and then you got off 5, 7 years later, and that's it. It didn't make any stops. There are no detours, there are no breaks or anything. And now people stop and break. They have children, they go away for things, they get an MPH, get an MBA, they're getting a combined MD PhD. They're that there's so many more different ways to skin that cat now that are not only acceptable but embraced.
Mhm.
And even the medical schools themselves with their flexible curriculums and building in a fifth year to the MD tracks and things like that. So I think that they have a lot more opportunities and options available for them. Maybe that makes it harder to figure out ultimately what they want to do.
Mhm.
Um, but yeah, and I do think that there's a little bit of a clash, at least potentially so, with this particular letter generation. What are we on, Z now? Or I don't remember what
Yeah, I
I
think
don't
we're
remember the
we're Z, or maybe
nomenclature.
we've gotten back to double A now. I make our way back
So
around.
these guys,
Yeah.
where it's kind of like the hashtag me first.
Mhm.
I just coined that right now, by the way. No, that 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 has a tendency to clash with the super old school, old surgical guard, right?
Yeah.
Like, um, there's no me in surgery. There's just,
Mhm.
that attending, if you will.
Right.
So, I'm sure that there's some, but the difficulty goes in both sides, right? Because the faculty have to adapt their teaching skills. If you're a good teacher, you can teach anybody. And so if you're not an adaptive teacher, you shouldn't be teaching, right?
Mhm. Mhm.
But I think it can be challenging because it's basically saying, oh, I know you've been doing this the same way for 20 years, but now you got to do it differently. Kind of like
Yeah.
the elementary school teachers and middle school teachers right now that
Yes.
are used to in-person instruction and all of a sudden
Yeah.
having to do all this remotely, whereas that's like a whole special thing that
Right.
they're being asked to do. So, but similar, I would think. I mean, I don't know, but I would
Yeah.
think.
Yeah. Well, if you had to give one piece of advice to a woman who wants to go into your field or really any field in which there just aren't a lot of other women, what would that piece of advice be?
Um, Come on, bring it. We want you. We want you. Um, you need to talk to people, and you need to develop your own resiliency because it is not an easy road, even
Mhm.
for our male counterparts.
Mhm.
And so you have to be really, really sure that that's what you want to do. So do your due diligence. And if at the end of the day, this is what fascinates you, this is what gets your juices flowing, then it can be done. But if you sit down and you try to talk yourself out of it and you're able to do so, then probably it isn't your passion. That was one of the bits of advice that I got. Like, if you're thinking of going to surgery, try to talk yourself out of it. And if at the end of the day
Mhm.
you can't, then you really
Yeah.
should do it. And so I think that because, when you're tired, when you're not wanting to come to work or do that next case or whatever, what is the thing that's going to get you through? And it's got to still be your commitment and your passion to the subject matter of whatever, whether it's orthopedic surgery, whether it's
Mhm.
law, whether it's, thoracic surgery, whatever. Like, you've got to be passionate about it and fully committed. And where there's a will, there's a way. So,
Absolutely.
I talk to female trainees a lot about, like, well, when's the best time to have your baby? If you want to get
Mhm.
married and have a baby. And I'm like, the best time is when you get pregnant.
It's true.
Like, I mean, like, there's no, like, yeah, we could split hairs and talk about the benefits of having your child early on, but the downsides of still being in training and what that does to your body versus waiting forever and then having fertility issues potentially and being an
Right.
older mom, like, it's all over the map, right? So bottom line is, you just need to do it when it happens and when it feels right to do it. Like, there's no blueprint for it.
Yeah.
And if you're thinking this deep in the weeds, you're probably thinking it too much. That's too much thinking. Like, I do think that um, it is harder to get into college. It's harder to get into med school, harder to do all of these things. So the bar is higher, and
Mhm.
that speaks to the amount of strategic maneuvering that students and trainees feel like they need to do. And so I don't want to be dismissive of that, because I
Mhm.
do think you do have to be more strategic, but you don't have to be so super deep in the weeds, because you'll wind up just tripping yourself up over,
Yeah.
like, minor details when you got to keep, the big picture at
Right.
hand. Like, keep your eyes on the prize way down there. It doesn't matter. Do I do OB-GYN first or do I do internal medicine first? Like,
Well,
it doesn't matter.
doesn't matter.
It's not that
I
critical.
think I think those are all really good pieces of advice. Well, if our listeners want to keep up with what you are up to, where can they find you online or on social media?
So I'm not that prolific on social media, but I do have my Twitter account, which is at Leah Backhus MD. I'm on Doximity. Those are the main two. And also, obviously, at the Stanford CT Surgery, our department website has more contact information and whatnot there too, with email addresses and whatnot listed. So
Perfect. It's been a pleasure talking to you. Thank you so much for spending this time with me today.
thanks, Nancy. I can't wait to see your podcast. I'll subscribe.
Thank you. All right. Well, that was
Okay,
great. Thank you so
wonderful.
much.
No,
That
this
was
is great. I'm so glad you're
awesome.
doing this. This is,
Oh,
I think,
thank
gonna be
you.
helpful to a lot of people.
I hope so. I'm really excited about it. I almost didn't do it. And when everything started shutting down, I was just kind of like, I had a little pity party. I'm like, oh my gosh, and my elective cases are going away. What am I going to do?
Yeah.
And just like worrying about everything. And my husband's home critical care, and so I was worried about the surge and like,
Yeah.
and his safety and.
Yeah.
Because he was like getting his gloves on. He's like, I'm ready. And he almost went to New York, and I was like, "No, we haven't
Oh,
had our surge
wow.
here yet. What if we have our surge?" But, and I would just, like, shut down for a little while. I think, like, probably a lot of us did, and then I was
Yeah.
like, "You know what? I need to have something to be excited about," and so I kinda did a 180, and I just flipped into high gear and just started calling, emailing, writing everybody I got, my podcast producer, working, and I was like, "We're gonna do this." And so, even while it's been kind of slow with elective surgeries, I've like knocked out a lot of interviews and should be able
Right.
to
See, it
launch
gave you
next
the
month.
space to do that.
Yeah,
It's the silver
totally.
lining.
It's the silver lining. Yeah, and professional, I talked to one gal who's a Major League Baseball coach, and she's like, "Welp, I have nothing to do right now, so I am free to talk to you anytime." So
Right?
it's
Like
great.
you can totally book these hard to get a hold of people. That's too
Yeah,
funny. I know we
yeah,
gotta
just
accentuate
funny
the
timing.
positive where we can
That's true.
because it's
Yeah,
not good
yeah,
otherwise. So
yeah. Well, it was so nice to talk to you and
yeah,
really
likewise.
excited to have connected, and hopefully I'll catch up with you again sometime soon. I've got
Yeah.
to ask you, who do you know from Hacienda Heights? Because you just never know.
Regina Wallace.
Regina Wallace. In medicine?
No,
In medicine? No.
she's not.
Okay.
She's in tech.
Oh,
Um,
okay. Yeah.
but
Doesn't ring a bell, but it
she
does
went
end
to
up
high
being
school.
small.
Yeah. I'm trying to think of when, so she would have graduated in 92,
I graduated
92.
high school in 91. I went to Los Altos High School, and then the other Hacienda Heights high school is Wilson. So curious. She would have gone to
Oh,
one of the
okay.
two,
So
I
what's
think.
the, is it Hacienda Heights High School? Is it Hacienda Heights
No,
High
no,
School?
Los
Oh,
Altos. Los Altos was one of them, and
oh,
then the
oh,
other.
I gotcha.
Yeah, I know there's a Los Altos High School near you, but different Los Altos.
Yeah, that's what I was
Yeah,
thinking.
it's confusing.
Um, like literally when in the Los Gatos, Saratoga High School District there.
Yeah, yeah.
Um, but yeah, I don't know
Oh,
which. I know she went to high school
probably
there, but yeah, she would have
we
graduated in
probably would have
92.
been
I
there
know.
about the same time. Did you graduate in 92 also?
91. Just
You're
like you.
91. We're the same age.
I know. And
Ah,
our 25-year college reunion is probably gonna get canceled.
I know.
They're like,
Well,
oh,
it'll
would
be
you
a
rather do
Zoom
it
reunion.
virtually? No, that's what they said. Like, would you? I mean, I don't. Where'd you go to undergrad?
UCLA.
Okay, that's right. You told me that.
Yeah,
So
yeah.
I don't know how UCLA does it. I assume they must do it really nicely as well. I'm Stanford. It's like a huge thing. Like, if
I
you're gonna go
haven't,
to any reunion, this
yeah,
is the one that you go to. And so,
yeah,
like, my friends and I were all looking forward to it. And so they're like, "Oh, well, would you like to do it virtually or like reschedule?" I was like, "Reschedule it. Virtually will suck. Like,
yeah,
we won't get any of the stuff, you know."
yeah, yeah.
So
Oh, it's tough.
yeah,
Well, let's keep our fingers crossed that, if we don't have a big second wave, and,
I
I
know.
just hope that things kind of, best case scenario sort of start to peter out a little bit, but it's hard to know.
That's
It's hard to
that's
know.
that's the hope. Well, you've got proximity to Seattle right there in Washington. So, but it hasn't been. I mean, Santa Clara County has been bad, but I think
Yeah.
artificially so because
Mhm.
Kaiser kind of funneled all their COVID patients to
Mm.
one facility here.
Mm.
So I think that kind of boosts the numbers up compared to
Yeah.
other local counties. But at Stanford, we haven't. It's no more than 20, 25 patients at any given time.
Yeah. Yeah.
So manageable, like no
Yeah.
surge teams
Same
create. I
here.
mean, the surge teams are created, but not,
Yeah.
nobody was called.
I think it was a good good exercise because it could still come. And then here in Oregon, our numbers are really good. They have been really good. And I was part of the antibody study where they had all the healthcare providers, do biweekly blood draws. And they ended that study early because the positives were so low that they're like, there's
Hmm.
no point in continuing right now. There's just very, very little exposure. But that also means that if another second wave comes, it still could hit us bad because we probably
Oh,
don't have a ton of
absolutely.
immunity.
And
So
we don't even know if the
vaccines.
antibody tests mean anything yet. I
Anything,
mean,
right.
we like they've
Yeah.
been offering it to everyone here, all, both COVID and antibody testing. And we're all sort of waiting for it to show up on our little phone apps, like your results. And everybody, hey, how
Yeah.
about you? Do you have any antibodies? Like, no, I really was hoping I had some.
Yeah. One of my friends, her first blood draw came back positive. We had a big group text going.
Ah,
Most of us are physicians, and we
yeah.
were all like, "Congratulations!"
Right.
It was like
The
this big
winners.
celebration. And then her second and third came back, and they were negative. She was like, "False positive." We're like,
Yeah.
"Oh,
It
yeah."
sucks. Yeah.
Well, I hope you stay safe and stay
Thanks.
sane,
You too.
and hope to connect again soon. I'll keep
Yeah.
you
Will you let me
posted
know
as
when
to,
when it comes
yeah,
out?
I
Sounds
absolutely
good.
will. All right.
Okay. Talk
Have
to
a
you
good
soon.
afternoon. Take care.
Bye-bye.
Bye-bye.